All right. Good afternoon. Good afternoon to all our Republic of CAF Informs. As always, we are grateful for your Thursday evening that you are here with us. And today we have especially important information regarding health insurance. We have Esly Ramos from Maryland Health Connection, and she will be talking about some of the changes that will affect health insurance in Maryland and how even more people can take advantage of the great opportunities provided by the American Rescue Plan, I believe is the name. So please stay tuned. As always, CAF, Center for Assistance to Families, is here to act as a vehicle, right, to inform you. We also have so many services to help you, such as home buying services, such as financial literacy. But of course, we also recognize that having health insurance, being healthy, is as important or even more important than having a home. So without further ado, we have Esly Ramos with us. Esly, please introduce yourself and tell us a little bit more about this amazing plan. Thank you.
Hi, everyone. So yes, my name is Esly Ramos. I'm a navigator for Prince George's County Health Connection. So the American Rescue Plan is amazing. It was passed by the Biden administration in March of this year. So not only does it extend and increase the unemployment benefits for the unemployed, but it also increases the financial assistance that people get um, when paying for their health insurance. So that means that most people will pay a smaller premium now.
And what a great resource. I know that there are a lot of changes that are happening. Can you talk to us a little bit more about how people can take advantage of this opportunity, flesh out the details a little bit more, and really just give us more information about how people can access this resource and potentially benefit from it also?
Sure. So I typically just really recommend people to go to marylandhealthconnection.gov or call our call center. The phone number is 1-855-642-8572 and apply, because you don't know what you qualify for until you apply, right? So basically, I can give you some scenarios. For example, a person who is around 27 years old, making around, for example, $25,000 a year, can now get around $240 in monthly savings to apply to their premiums. So, since I do help people with their health insurance applications, I've seen adults that make around $30,000, single adults, pay a dollar or two for a good quality health insurance plan. So I really just do recommend that people apply, because you can estimate, right, your savings, but you won't really know what you'll pay until you apply. And
Of course.
also, I do just want to touch on, I'm sorry, I do want to touch on, if you have gotten unemployment at any point during 2021, even if you're not on it still, you get even greater savings. So you might even qualify for um, a premium of zero. So you won't have to pay anything for your health insurance. Okay, so today I will be talking about what is new with Maryland Health Connection. So many of you are probably familiar with Maryland Health Connection, but there are some new and important updates in light of the COVID-19 public health emergency and also the American Rescue Plan that I'll share with you today. So we're just going to cover some of the basics. So Maryland Health Connection is the state's official health insurance marketplace. So it's a one-stop shop where you can compare health insurance plans side by side and just pick what's the best plan for you, for your family, and more importantly, for your wallet. So it is important you can get financial help. So if you go to marylandhealthconnection.gov, you'll find that around 9 out of 10 people who enroll get savings, whether it be Medicaid, where you don't have to pay anything for your premium, and you get free medical services, to financial assistance in the form of tax credits in the case that you do have to pay for your insurance. So there are a lot of ways to get for your low cost coverage. Like I said, you could get Medicaid. For example, a family of four that makes less than around $36,581 qualifies for fully free insurance, which is amazing. And better yet, children get full dental and vision benefits at no cost. If your income is a little bit higher, you can still qualify for reduced health insurance costs in the form of tax credits. So, did you know that the American Rescue Plans includes really big savings for health insurance? So, find out what your options are. If you are uninsured, it's extremely likely that you qualify for just free health insurance, so Medicaid. And if you received unemployment during any time in 2021, you can get a premium for as low as $1 or $2, even if you're not receiving unemployment currently, just 21. All right, and these are just some scenarios. Like for example, a family of four with a household of around $53,000 will get a monthly savings of $1,015 per month. So that's not per year, that's every single month. With a household income of around $35,000, can get a savings of around $1,400 every single month. And like I said before, with these savings, I've seen people pay $1, $2, $3 for very, very good health insurance. All right, and I do just want to emphasize something important about immigration status. So there are many immigration status that allow someone to qualify for health insurance, such as being a lawful permanent resident or having TPS, which is temporary protected status. But Maryland Health Connection is not available to those who are undocumented. But with that being said, if someone in your household is eligible, they should apply. So we don't need the immigration status of anyone who's not applying. So for example, if your child qualifies, right, and you do not have an immigration status, no worries. We don't need any of your information because you're not the one that's applying for health insurance. So you can find more information about immigration status at marylandhealthconnection.gov. You can just find a plethora of resources there. All right, and these are just some of the basic things that are covered in health insurance. So more importantly, preventative care. Preventative care is typically no cost at all to everyone. And different things like hospitalization, doctor visits, maternity care, and newborn care as well, including COVID-19 testing, which is extremely relevant right now, treatment and vaccines at no cost. All right, so in response to COVID-19, the state opened up a special enrollment period that lets Marylanders enroll and get coverage now. So that special enrollment period ends August 15th, right? So you can apply if you don't have insurance, if you're working, even just to check if you can get a lower premium per month. I recommend that you go to marylandhealthconnection.gov and see if you qualify for insurance or reduced premiums. All right, so just a few things. If you're going to apply, these are just some of the documents that we need you to have ready. So photo ID, social security number, immigration status if applicable, and just employment information such as pay stubs, W-2, tax statements, if you are employed. All right. And I just really want to emphasize that us navigators are really here to help. You can contact us at any time. If we're not available, you can always find information on the website. And again, our phone number is 1-855-642-8572. Okay. All right. So, like I said, our navigators have adapted to safety provide support for you. So, like I said, we are here over the phone at 1-855-642-8572 and online on marylandhealthconnection.gov. All right. Here's some more information on where you can find us, and please just make sure enrollment ends August 15th. All right. Let's get covered, Marilyn.
Okay.
Okay.
Esli, thank you so much for all of the extremely valuable information that you provided for us. Um, as we know, the health insurance landscape is going through massive changes at this moment, so being informed is more important than ever. Um, I would like to take a moment to share some of CAF's resources. So CAF Center for Assistance to Families has a number of events designed to help the community, specifically in this area. So please visit us at www.mycaf.org, and there you will see the services that we provide. The vast majority are completely free. And nothing, as Esli had said, get covered, Maryland, and CAF is here to help. So if you need more resources, more information about Esli, feel free, obviously, to go to the resources that Esli provided in her presentation, and also CAF's website will always be there to help. So it is an honor and a pleasure to be part of helping and empowering Maryland communities, and we will see you once more next Thursday. Thank you very much.